Crabtree doctrine is, you absolutely must get control of the things that are within your control, or the things that are not within your control will control you. Let me ask you, what are the things that are within your control? Do you control open? Do you control when you close? Whoa, wait a minute now. I didn't get everybody on that. Do you control when you close?
Yes.
Absolutely, you control when you close. And if you don't think you do, then you need to take a look at probably that number one thing Dr. Tony said. Do we have a cohesive approach to everything? If you don't have a weekly meeting, you probably don't have a cohesive approach. Everybody's got to be on the same page. Matter of fact, you should write this down. You guys ought to have an agreement in your practice. Start out on time, stay on time, and get out on time. Do you have the ability to control when you close? Absolutely you do. Unless you are of a convenient mindset. Start out on time, stay on time. Do you control how many days you work? Yes, you control how many days you work. Do you control how much you charge? Yes, you absolutely control how much you charge. Do you control how many patients you see every single day? Now, if you think you don't, then you ought to write down on your board, get control of your schedule ASAP. And maybe have a conversation with Cameron and I at a break or something about how to do that. If you are not taking control of your schedule, the patients are. And if they do, guess what? You've lost all control. I would submit that you will take better care of your patients when you control your schedule than they will. Than you can otherwise. You control how many patients you see each day. Do you control how much time you spend with each patient? Careful now. Do you control how much time you spend with each patient? Absolutely. Absolutely, you control how much time you spend with every single patient. And if you don't, then I would submit the orchestration is not right. Focus is probably on you rather than the focus being on the patient. If you'll put the focus on the patient, you can get to the nitty-gritty of what you want to do and go to the next chair or whatever else you have to do.
That can also go back to what Dr. said.
Oh, right. Absolutely. Because everybody has to be on the same page. To control how much time you spend with each patient, you have to have a focus on what the outcomes are. And I can tell you this. This may surprise you. Your ability to create a solid, lasting relationship with your patient has absolutely nothing to do with time. Absolutely nothing to do with time. It has a lot more to do with, what would you say, Valerie? Believe it or not, creating value is what it has to do with. It has to do with creating value. When you create value for your patient, it has nothing to do with time. As a matter of fact, I would submit, if you're spending too much time with your patient, you're sending an unconscious or subconscious message that you ain't got a whole lot to do. And if I'm a patient, I'm worried about a doctor that ain't got a whole lot to do. Or assistant or hygienist, right? Do you control what is diagnosed, doctors? Absolutely you control what's diagnosed, don't you? You don't control what's happening in the mouth, but you control what's diagnosed, right? How many believe that you control what's diagnosed? Okay, y'all are just, okay. Do you control the final outcome of the clinical procedure? Yes. Do you control whether or not patients accept treatment?
No.
To some extent.
To some extent?
More than to some extent.
More. Do you control whether or not the patients accept treatment? Absolutely 100% yes. But to be able to control whether or not your patients accept treatment, you have to be of the mindset that you can control it. If you don't think you can control it, you're going to be at the mercy of all the other stuff we talked about. Economy, Disney vacation, right? Flat screen, plasma TV, whatever else. By the way, those are your competition. Those are your competitors. You guys know that, right? Nobody in this room is competing against anybody else. You're competing against those things that take up discretionary income from the patients. Dentistry, as Dr. Watkins said a moment ago, dentistry has become, thank goodness, it's become an elective situation. There was a time that you can probably remember, sir, dentistry was a whole lot like fix and repair, carpentry kind of stuff. It's not that way anymore, thank goodness. It's elective. And everybody on the planet wants a great smile. Everybody on the planet wants white teeth. Everybody on the planet wants the confidence that comes from that great smile. Doesn't matter what their socioeconomic status is. Doesn't matter where they live, what they drive. Doesn't matter where they're from. Everybody wants that. You have to believe that, or you're not going to be able to take control of whether or not your patients accept their treatment. And we're going to talk in depth about that.